Hello, the topic for today's mini-talk is modifiable risk factors for cardiovascular disease. On the agenda today is to review the modifiable risk factors for cardiovascular disease. We will also review strategies for how you can manage and take control of your risk factors. Research tells us that there are several risk factors that play an important role in determining whether or not you are likely to develop heart disease. Knowing your specific risk factors is important for prevention and rehab. Some risk factors, such as age, ethnicity, and genetics, are beyond our control. The good news is there are several risk factors which we can take steps to manage and control. Let's take a look at some of these risk factors. Sedentary lifestyle and low cardiorespiratory fitness. In today's society, we have become increasingly sedentary. This can be associated with a low cardiorespiratory fitness. Evidence tells us that low fitness levels are associated with an increased risk of cardiovascular disease, certain types of cancer, and dementia. Stress. Stress affects all of us in one form or another. Keep in mind that everyone feels stress differently and reacts in different ways. Our bodies respond to exposure to stress by releasing fight or flight hormones such as cortisol, which increase heart rate, blood pressure, and breathing rate. When stress is excessive and we are having trouble coping, it can contribute to high blood pressure and have an impact on other behaviors that affect heart disease risk. Some examples include overeating, sleep disorders, smoking, alcohol consumption, and physical inactivity. Diet and nutrition habits. Foods that are highly processed are often high in added sodium, sugars, saturated, and trans fats. This may elevate cholesterol, triglycerides, blood sugar, and blood pressure values. Poor nutrition habits can also contribute to an increase in body weight and waist circumference. Blood pressure. Blood pressure can fluctuate throughout the day due to certain lifestyle factors, such as sodium and caffeine intake, stress, and sleep habits, to name a few. However, if your blood pressure is consistently elevated, this increases the pressure in your arteries, making your heart work harder than normal. Over time, the pressure can damage our arteries, leading to plaque buildup, otherwise known as vascular disease or atherosclerosis. Elevated blood glucose. Over time, elevated levels of sugar in our blood can damage the nerves and arteries. This can lead to cardiovascular disease, as well as damage to the kidneys, eyes, and nerves. Elevated cholesterol, in particular excess LDL, or bad cholesterol, circulating through our bloodstream can contribute to the process of atherosclerosis, or narrowing of the arteries, which can limit or block blood flow to the heart muscle. Elevated blood triglycerides may also contribute to plaque development and increase the risk of heart disease. Smoking and exposure to secondhand smoke. Carbon monoxide and other chemicals in cigarette and cannabis smoke can cause damage to your arteries and contribute to plaque buildup. It can also decrease the oxygen carrying capability of our blood, increase the risk of blood clots, and cause harm to our lungs. Alcohol consumption. Excess alcohol consumption can contribute to elevated blood pressure, cholesterol, and triglyceride levels. It can also lead to an increased risk of stroke, heart failure, and irregular heart rhythms. In addition, alcoholic beverages can be high in empty calories, making it challenging to manage our weight and waist circumference. Sleep habits. Poor quality sleep, chronic sleep deprivation, and conditions such as untreated sleep apnea have been linked to an increased risk of heart disease. Overall, it can have a detrimental impact on our physical and mental health and well-being. Let's now discuss what can be done to manage these risk factors. Regular physical activity and exercise. Research tells us that an increase in our cardiorespiratory fitness level is associated with improved health outcomes, including longer life and a better quality of life. The goal is to try and get our fitness level as high as possible, regardless of where our starting point lies. Current guidelines recommend that we try and accumulate 150 to 300 minutes of aerobic or cardiovascular exercise each week that is moderate in intensity. In addition, resistance training exercises using machines, dumbbells, exercise bands, or body weight should be completed 2 to 4 days per week. Not only are we increasing our fitness, but exercise can have a positive impact on other risk factors such as blood pressure, blood sugar, cholesterol, and emotional well-being. It can also lead to improved sleep quality and improvements in our waist circumference. If you are just getting started with exercise, make sure to start gradually and speak with your exercise therapist for guidelines. Following a heart-healthy diet, reducing our consumption of highly processed foods and increasing our consumption of whole foods such as grains, fruits and vegetables, healthy fats, and fiber can improve our cholesterol and triglyceride levels, our blood sugar levels, and our waist circumference. Look for additional resources on our website for heart-healthy eating guidelines or speak with your exercise therapist if you would like a referral to the dietitian. Managing stress. Finding solutions on coping with stress is unique to every individual. Perhaps consider trying some meditation or mindfulness exercises to calm your body and mind. This can lower blood pressure, blood sugar, and improve our sleep quality. Finding what works best for you is key, but other suggestions may include listening to music, reading, hobbies, maintaining strong social networks, and gentle yoga. Keeping blood sugars at optimal level. In some cases, we can lower or keep our blood sugars well controlled with a well-balanced diet and regular exercise. If your blood sugar is elevated, you may be considered for medication and diabetes education. Talk to your doctor or healthcare practitioner about your blood work values and your targets, and ask about specific treatment options. Adhering to medications prescribed by your healthcare provider. Medications, when taken as prescribed, can be an effective part of our treatment for conditions such as diabetes, hypertension, heart disease, and elevated cholesterol. Speak with your pharmacist or healthcare provider if you have questions about your specific medication regime. Establishing good sleep habits. Remember that sleep requirements vary from person to person, but general guidelines recommend that most adults achieve 7 to 9 hours of sleep per night. If you suspect you have a sleep disorder or a condition known as sleep apnea, please speak with your doctor for a referral to a sleep specialist. Alcohol considerations. Based on current evidence, if you do not currently drink alcohol, it is not recommended that you start. If you drink alcohol, stay within the recommended guidelines of 0 to 3 drinks per day, up to a weekly maximum of 15 for men, and 0 to 2 drinks per day for women, up to a weekly maximum of 10. You should always speak with your doctor to discuss if alcohol is safe for you. Quit smoking strategies. Reducing smoke exposure will have a positive impact on your health. When planning to reduce exposure to smoke, develop a plan and get support. There are many smoking cessation strategies to help you cut back and improve your long-term success of quitting. If you want more information, speak with your healthcare provider or exercise therapist. It is important to keep in mind that making behavior changes is always challenging and can be overwhelming if you try to tackle too much at once. Your healthcare team can help you figure out which risk factors you should focus on and help you with goal setting. To summarize, I want you to think of one thing you've learned from this presentation. Perhaps it is that there are many things you can do to take control of your risk factors. Knowing your individual risk factors and making small healthy behavior changes in your daily routine can improve your risk factor profile and health outcomes. Perhaps you've realized there are 1 or 2 specific areas that you would like to make some changes, and you've been able to think about some small goals that you would like to work on. For more information, speak with your exercise therapist, and be sure to have a look at our website, gethearthealthy.ca/patient-education, for additional resources and a look at our calendar of upcoming events. That concludes our talk for today. Thank you for listening.